Here's the introduction to medical foot care. First thing you'll do is perform hand hygiene, put on safety glasses and gloves, and set up your field. So once we're all ready, we're going to inspect the foot. You'll want to look at the toes for any deformities. You'll want to inspect in between the toes for any breakdown in skin or fungus. You'll want to look at all areas of the foot, especially the back of the heel, any bony prominences, both medial and lateral edges, and just inspect for the quality of the skin and any breakdown. Then we're going to use our monofilament, which has a guide on the back of the 4 areas that you must test. This determines if the patient has sensation or not. To properly use this instrument, you will tell the patient to let you know when they feel you sticking them gently. So they must have their eyes closed in order for it to be done properly. And so according to here, we're going to go right on the big toe at the base of it, the plantar surface, and you push in to enough to bend the monofilament and release. And then we'll go to the first metatarsal head, bend, release. Go to the 3rd metatarsal head, bend, release. And the 5th metatarsal head, bend, release. Those areas have been shown to be the most indicative of whether a patient has protective sensation on their feet or not. It's because most of these patients, actually all of them, have neuropathy. It's unlikely you'll get very many results from this test. They mostly won't feel it. Then the next thing that you're going to do is actually release the free edge of the nail. So using your manicure stick, we'll go along the edge. This is the free edge of the nail, and go up underneath, and you can release the edges if they're stuck. We'll go along the edge for each one. And then if you notice any really overgrown cuticle areas, you can gently use the cuticle stick to remove the dead tissue there. Okay, if you have an ingrown, we'll deal with it after we clip the nails. You can take your nail clippers now, and what we want to do is go follow the edge of the toe. So we want to kind of follow that rounded shape. And we don't want to get too close to the free edge of the nail. If you have a big, thick, overgrown toe, you may want to actually, when you're clipping, put your finger over the top edge, and that way it won't fly out. So we'll go and clip here. There we go. Okay, so you will probably be from this angle, but whatever angle is easiest. Okay, and we can make a few additional trims if needed. You can rotate your clippers to get either side. We don't want to cut the lateral edges too short because we don't want to cause ingrowns. Okay, once they're trimmed down, the next step is to file them. You'll have two different emery board options. The reddish brown one is going to be a really light file. I'll typically use the black one first, especially for the really thickened nails. So we'll go along the edge and make these edges really smooth so that they don't have the ability to cause injury. If the nail is thickened on the top, for instance with the mycotic fungal nails, you can actually file down the whole top of the nail. So we'll go along and file these edges. And then you can hold the individual nail while you do it as well. You want to get them filed nicely, and then you can go along the top of the nail like this to make sure that the edge right here is not sharp as well. And then we'll want to do some callus work. So if you notice any calluses on these bony prominences here, you can use the black file to file them down. And what you're looking for is to have it softened when you press on it. When it's thick and calloused and hard, it doesn't allow for any give as the patient walks on it, and that's when we have injury happen. You can get cracks in the callus and they become wounds. So it's nice to keep them filed down and soft so that there's give when the patient's walking around. You'll also want to check the heel here for callus and file here. Okay, you can certainly go over any edges with this one. It's not going to be as strong of a file though. Okay, if you have an ingrown, you can take a piece of a cotton ball or a strip of an alcohol pad. I would most certainly, if we have an ingrown area, clean it with the alcohol pad. It'll probably be nice and red. And you can cut a strip. You can pack the ingrown area. With a piece of alcohol swab. We want to prevent the nail from growing back into the area that it had damaged before, so you'll just pack this under the free edge of the nail and the lateral edge where the ingrown is. And so you actually leave that in place. You can also use a piece of cotton if you'd like. And what that will do is provides a spacer so that the nail will grow on top this way instead of back into the skin. You can tell the patient that you're leaving a piece in there, so in case they notice something falls out when somebody's helping them, you know, change socks or what have you, that's expected. Okay. Then we will use a baby wipe or some gauze with soap and water. Clean the whole foot. You really want to clean in between the toe spaces as well. Want to get really well in between here. So we'll do that with soap and water or a baby wipe. And then make sure that you go back with a completely dry one and get these toe spaces really dry. Okay, once everything's dried off, you can apply antifungal powder. The best one's going to have miconazole in it. It's over the counter. This one can be ordered online, or you can go to any drugstore. Z-Sorb is another brand. This is really good for the in between the toe spaces, or if there's any moist skin from fungus on the outside. So you can put that in the toe spaces. And then we'll put moisturizing lotion to any areas of dry flaking skin. Do not put any lotion or moisturizer in between the toe spaces. So we'll moisturize that and help them put on their socks and shoes. It's a good time when you're helping them to put on their socks and shoes to inspect their shoes and discuss any foot orthotics or possible adjustment to the shoes where they might be rubbing on the calloused areas. That is it. Take off your gloves and do hand hygiene.